Good morning, everyone. I guess we can start. Can you hear me?
Yes, we can.
Perfect. Thank you very much. So good morning, everyone, and welcome to the webinar EU4Health Tenders. First, let me introduce myself. I'm Francesca Castaldonna, and I'm a member of the ProMIS network. And I will moderate this event today, this third appointment of the training program organized in the framework of the joint action on national focal point EU4Health. For who is not familiar with this joint action, I will give you some information in a nutshell. The joint action on increasing the capacity of national focal point is funded under the European Public Health Program and aims at contributing at creating an innovative, sustainable and coherent network of national focal point. And that will increase of course the capacity of member states to design and create a sustainable action to promote the achievement of health objective for the period 2021-2027. The objective of this webinar is to provide the national focal points and stakeholder with a general overview of the EU4Health Tenders with a specific focus on tenders management. And moreover, some space in the agenda is reserved to the presentation of concrete experiences. Just a quick note before starting, the session will be recorded and you can, I kindly ask you to switch off the microphone during the presentation, but if you have any questions, you can write them down in the chat and we will collect them and ask the speakers to reply after their presentation or during the Q&A session. Last informative, important service information. I also kindly ask you to fill the survey you will receive after the webinar. Since the results of this survey will be taken into account as part of the joint action activities, so please, it's really important to us to collect this information. And I'm glad to welcome, of course, our speakers. Thank you for being here. I think that Giovanni Nicoletti is not connected, but maybe later we'll connect. I cannot see the participant, but we will start with the first speaker, that is Chiara Tripepi from the European Health and Digital Agency, Executive Agency ADEA, who will provide an overview of the EU4Health and its trends, and will give you some important information about the public procurement, the life cycle for public procurement, and upcoming and open calls to help us a little bit understanding what's going on. Then we will move to the presentation of the Italian National Institute of Health, the Istituto Superiore di Sanità, and that is represented today by Margherita Gentile and Maura Mareri. Who will bring us some practical example concerning the EU4Health tenders participation from the point of view of the member states. And then a last session is dedicated to an open discussion. So if you have any questions, remarks, doubts about this important topics, please don't be shy and ask. And I'll give the floor to the first speakers. So Chiara, thank you very much for being here. Thank you for your availability, and the floor is yours.
So thank you very much, Francesca. Good morning, everyone. Just a quick practical question. Are you going to share my presentation, or do I have to share it?
If you want to share it, maybe it's better so you have the
control. Yes. So I will just 1 second open it. Tac, tac, tac. So do you see it or not?
Yes.
If you can, perfect.
If you can put in a presentation mode.
Yes. Yeah. Okay. So and I'll move that here, so you should see the whole screen. So I don't see anything else now except my presentation. So if there is anything, just interrupt me, because I only see my screen now. So, well, good morning, everyone. I'm very happy to be here in this webinar today. I think it's very important that we have the opportunity to raise awareness on public procurements within EU4Health. So today, as Francesca mentioned, we're going to have a sort of voyage through public procurement. So we will start from general information, going through EU4Health, and then practical hands-on on how to submit an offer using the tools we have. And then we will have an outlook of ongoing calls, so open call for tenders and upcoming calls. So let me move to the next slide. It's not perfect. Okay, yes. So before we really dive into the content, I would like to remind you the main features about public procurement. So as you may know, by public procurement, we mean the purchasing of work, supplies, and services by public bodies. In our case, in EU4Health, we are, as HADEA, so as the Health and Digital Executive Agency, we are the public body buying work, supplies, and services, and we are then called the contracting authority. It is important to know that we are the one in charge of drafting the detailed specification. So we, together with the parent DG, so either DG Sante or DG Hera, we are drafting what we want to buy. So we are in charge of preparing the tender specifications or the technical specifications. It is important that you know that the result of the action remains the property of the contracting authority. What does it mean? It means that if you are preparing a study, so if we are buying a study, at the end of the contract, the contractor will have to transfer everything to us, so to HADEA, and we become the sole owner of the results. And of course, you transfer also all the IP rights and everything that is linked to the preparation of the study. It is important that economic operators that are applying for procurements know that there is no pre-financing in public procurement, and that we only pay the invoice against the delivery of the services as per the contract signed by both parties. So as you can see, it is quite a different system in comparison with grants, with which you might be a bit more familiar. And of course, one important thing is that, of course, public procurement is for profit. So there is this economic, I would say, interest in participating in public procurements. For the sake of clarification as well, we have different public procurement procedures. Today, we are going only to focus on open call for tenders, which are published on e-tendering, and we will go through that in a couple of minutes. But we also have requests for services. For requests for service, we use existing framework contracts. So we have open call for framework contracts. Once those are evaluated, we have a number of economic operators that are part of this framework contract. And we can send them requests for services. So the invitation to submit a tender will only be sent to the economic operators that are part of a framework contract. So there is no publication of these requests for services on e-tendering. And then we have negotiated procedures as well, where there is the possibility, as per the name, to negotiate with the tenderer about the content of what we are going to buy. But today, we are really going to focus on open call for tenders. So I think that, many of you were in Brussels on Friday, where we had this meeting, HADEA joint action, and during which both Antonio Di Giulio from DG Sante and Angelo Marino from HADEA clearly expressed the importance and the relevance of EU4Health. So as you know, EU4Health is the fourth health program. It is the biggest health program ever in terms of funding. We have 5.3 billion euros to be invested in between 2021 and 2027. The program, well, the regulation was drafted during the COVID pandemic. So if you go through the regulation, you will clearly see that it is an answer or a response to the COVID-19 crisis, because policymakers didn't want to be ever again, didn't want to face ever again such a crisis as it was with the COVID-19 crisis. So a lot of efforts have been put forward to being ready for any health crisis. The big budget also shows the intention to really contribute to the establishment or the creation of a health union. So what we want to achieve through EU4Health is actually to have a more healthier Europe, a Europe that protects its citizens from health threats and from diseases, a Europe that is digitally transformed in with regards to health systems, but also a Europe that can have access, quick access and affordable access to medical products and pharma products. How do we implement EU4Health? So as you may know, we have annual work programs, so it's AWP. And every year we publish one annual work program. So at the moment we are implementing the annual work program 2022. Efforts are being put in place to draft, design and approve the annual work program 2023, which is likely to be available at the end of this year or early in January. So let's focus today on the annual work program 2022. As you can see, there are four main strands. You might have looked at it. I mean, I'm pretty sure you're familiar with it. We have four main strands and one cross-cutting strand. So the first one is crisis preparedness. In the annual work program, it is reported with the code CR. We have DP, disease prevention, health systems and health workforce reported as HS. And then the fourth one is digital transformation, referred to as DT. And cancer, which is, of course, one of the major health challenges we are facing currently, is transversal to all of those four strands. The total budget available under the annual work program 2022 is it is above 800 million euros, which is a big pot for 1 year, especially if you consider that the third health program had an overall budget of 500 million for 7 years. So you can really see the difference in size, in relevance, and of impact of EU4Health. So what about the situation of procurements in the annual work program 2022? So we are launching 29 procurements this year, which will be implemented both by HADEA and DG Sante and HERA as well, actually. And we have an overall budget of 300 million. Calls are published on e-tendering, which is the official portal for the publication of call for tenders. And as my colleague mentioned on Friday, the procedure for public procurement is extremely long. It takes about 6 to 9 months between the publication on e-tendering and the signature of the contract. So yeah, this is just to show you where we stand so that you can also understand the length of the program. We have 29 actions and we have prepared 23. 7 are published, 5 are evaluated, and only 3 contracts are signed. So you might ask yourself why this is such a long procedure. So here I have prepared a slide that provides you with the procurement life cycle from our perspective, so from the contracting authority perspective. So we publish the calls on e-tendering, so they are open for submission. They remain open for at least 37 days. So once they are closed, we have the opening of the offers received. This is a purely administrative task where we actually check that the offers contain all the documents needed and that they were submitted within the deadline. We then move to the next step, which is the assessment of the offers received. And this is done in-house. We are, as contracting authority, responsible for the evaluation, and we conduct it together with colleagues from DG Sante or DG HERA. So it really depends on which parent DG we are working with for the specific procurement. Following the evaluation, we have to draft an evaluation report, which of course, it's an evaluation. So we really go through the award criteria, we go through the exclusion criteria, selection criteria, we check the financial offer. And this evaluation report goes to the ACPC, which is an internal advisory committee that really checks that the work has been carried in a proper manner. Following this ACPC, so the ACPC will give a positive or a favorable or non-favorable opinion to the authorizing officer, who is the person in HADEA that is going to sign the contract. So the authorizing officer signs the award decision, and we can send out information to successful and unsuccessful tenderers. Each of them receive its own evaluation report, so they know how they were assessed. And then following that, there is a contract signature. For open call for tenders, we usually ask the contractor, so the contractor to sign first, and HADEA signs as a second party. The contract enters into force when, of course, the second party signs it. And then we have the contract implementation, which is like the daily management of the contract, and during which we expect all the delivery of the different elements that we are buying through this procedure. So what is the perspective of the applicants, so of the economic operators that want to become of the tenders? So the calls are open for submission. Then there is the preparation of offers. So you have about 37 days to prepare the offer. You have then to submit the offer. It goes through evaluation. So you wait, basically. You receive the information, and then the contract is signed. For successful candidates, successful tenderers, in between the letter and the contract signature, it is possible that we require additional documents. And then there's the contract signature and the contract implementation. So, sorry. How can you submit your offer? Because I think this is an important element for all of you to know. So basically, when calls are open for submission, they are published on TED, so on e-tendering, which is the official portal for the publication of public procurement. So this is really the only place where you can check the situation of call for tenders, find all the documents. It is really the official page. We also do in HADEA, of course, we do advertisement, but all the official documents are found on e-tendering. So this is really the place where you need to go and search for information. This is how the homepage of e-tendering looks like. It's not very, I would say, user-friendly, but this is how it looks like. So on the left side, you will see that you have a vertical menu, call for tenders. And there you can search for call for tenders, search for a document, and there's the frequently asked question. So your journey in e-tendering starts here. Once you click on search for call for tenders, you are redirected to this second page where you can identify, select the contracting authority, the status of the calls, the start date, the closing date, and the types of procedures. Once you make your selection, you get at the bottom, for instance, I tried it with Hadea, of course, you get at the bottom all the open call for tenders. So you select the call you want to look for, and you are directed to this very page, which is the one of the call. And you have 3 tabs: data, document library, and question and answers. So in the document library, this is where you will find all the documents related to the call. So the technical specification, which are, you know, the heart of the procedure, because this is where you will find all the information on the services or supplies that we want to buy. Then you have the draft contract, because this information is public. It is, of course, a draft contract without any data. So there's not the price, there is not the names, that it's an empty template, but it is the template that is going to be used. So you have all the provisions that are going to apply to that specific contract. And then you have the financial offer, so the template for the financial offer, and the declaration on honor that will need to be signed when submitting the offer. So as I was saying before, the tender specifications are the essential document for you. So for any economic operator that wants to apply for public procurement, it contains the description of what we're buying, the procedure used for the procurement, the minimum requirement, the selection and exclusion criteria, the award criteria, which is very important because this is what the tender will be evaluated against, and then a list of documents that the tenderer will need to submit with its offer. So my piece of advice is, of course, read carefully the tender specifications, go through them, check what is asked in details, and then from there you can decide whether to apply or not. For your information, in terms of submitting an offer, so economic operators can submit a tender either as a sole tenderer, so only one entity, or as a group of tenderers. Yeah, a joint tender is a situation where a tender is submitted by a group of economic operators, regardless of the link they have between them. And the group as a whole is then considered a tenderer. All the members of this group become liable towards the contracting authority. And the group members will appoint a group leader and a single point of contact authorized to act on their behalf with the contracting authority. When you draft a joint, I would say, tender, you really have to clearly indicate the different roles and tasks of each member of the consortium, as well as you have to nominate a contact point for the contract's administrative and financial aspects. So we are not going to send an email to all the members of the consortium, but with the lead member. This is also to avoid any kind of, losing information. So there is one, I would say, lead operator that is in charge of then sharing information with the members of the consortium. Subcontracting is allowed. You have, of course, to read carefully the technical specification, because in principle it is allowed, but it might be that for some calls we are not requesting subcontracting. And there is the amount, of course, you cannot subcontract 100% of the budget, so that there are minimum and maximums that can be subcontracted to other economic operators, and all of that needs to be, of course, included in the offer that you are submitting to HADER. If we go back now to e-tendering, so the third tab, question and answer, the one in red here, is also pretty important. Why? Because actually we are not allowed to have any interactions with economic operators or with tenderers. This is because we need to ensure equal treatment sorry, and equal access to information for all interested parties. So this is the place, the entry point where you can submit your questions, and where HADER, as contracting authority or as body responsible for the call for tender, will provide you its answer in written. So it is always very useful if you decide to, submit a tender, to keep an eye on all these question and answers. If you contact us, you will not receive any information by email or by phone. So really, it's really forbidden to have any kind of contacts with the contracting authority. Now the interesting part, how to submit a tender. So how can you submit your offer? This again is a screenshot of e-tendering. So we have the three tabs: data, document library, question and answers. If you go to the right side of the screen, you will find another toolbox, I would say, with submit a tender. So you will have to click, of course, on that title, and you will be redirected to e-submission. So this is really where you have to upload your offer. So the first screenshot on top, I don't know if you can see that. So on top, this is what you see when you arrive on the page. So there is a summary of the call for tenders. So there's the reference to the procedure, the procurement type, the publication date, the deadline. So all the information that you need to have on the call. You will have to tick the box that you accept the terms and conditions, and then you can click on new submission. You will see that you have a sort of metro line, we can call it that way, with a number of steps. So here you will have to indicate whether how you're going to submit your offer, if the offer is a sole submission or a joint submission. So if there is going to be only a sole tenderer, or if it's a consortium, and if there is or not subcontracting. Yeah, the next step would be to include, so number 2, parties will be to include all the data related to the different parties, to the different members of the consortium. The tender data is the uploading of your offer, both technical, so the description of the work you're going to carry out during the implementation of the contract, and of course the financial offer and all the annexes. You then move to the step 4, where you will receive a submission report, and then step 5 is when you really submit the offer, and there's no way back after that. So that's it. You submit your offer and you have to wait. In the meantime, we receive the offers, we go through the opening, so we do the checks, and then we can launch the evaluation of the offers received. So what we do is we check if the tender has access to procurement, we verify all the administrative compliance, we verify the non-exclusion of tenders based on the exclusion criteria. All of these is included in the tender specification, so you have everything with you. We also assess the selection of tenders on the basis of the selection criteria. We check the compliance with the minimum requirements defined in the tender specifications. And then, of course, we do the evaluation based on the award criteria. So basically, this is why I'm saying the tender specification are the clue document for you. This is where you will find all these elements, and you will be able to build your offer based on the award criteria, based on the exclusion criteria and the selection criteria. So I think it is really important to have a deep analysis of the technical tender specifications. And yes, of course, if during the evaluation we see that one or more elements demonstrate that there is ground for rejection, then of course the tender will be rejected and will not be subject to further full evaluation. And of course, the economic operator will be informed. What about the exclusion and selection criteria? What are those? So really, this is the objective of the exclusion criteria is to see whether the tender is in any of the exclusion situation as per the financial regulation. And for that, during the submission phase, we ask that each tender submits a declaration on honor, which is always annexed to in the whole document list. In terms of selection criteria, we use them to assess if the economic operator has the legal and regulatory capacity, economic and financial capacity, technical and professional capacity. And as you can imagine, those selection criteria change, so they are not set in stone. For each different call for tender, we have a different set of selection criteria. So once we end the evaluation, we inform, as I was telling you, we inform the successful and unsuccessful tenders. So all the people, all the economic operators will be informed about the results of the procedure, whether they are successful or not. As I mentioned earlier, all of them will receive their own evaluation report, so they can see how much, how their offer was assessed, in terms of award criteria. The contract signature is the last step, I would say. So the successful tender will receive the contract for their signature. We usually ask the successful tender to sign first. We are now using QS, so the qualified electronic signature, and we send, of course, all the explanation on how it works. And lately, we have been signing most of our contracts with QS. In case the contractor does not have QS, they will have to sign in blue ink and send the signed contracts to ADEA for our own signature. And of course, the contract enters into force when both parties will have signed it, or according to what is included in the contract. Sometimes we have fixed starting dates, like 1st of November, because we know that we need that contract starting on that very specific date. So now, so this was, I would say, the more hands-on part. So how to submit an offer, what is needed, and how we assess them. So now let's have a look at signed contracts and upcoming calls for the annual work program 2022. So just for your information, we have signed a number of contracts this year. Those are both from 21 and 22. And this is really to give you an overview of the different types of contracts. So we bought a study on AMR medical countermeasures in the market. We bought the e-travel tool, Healthy Gateways, but we've also, bought a study on obstacle to vaccination that has recently started. So it's really, we buy a variety of services and supplies. An example of a contract for supply is the one for monkeypox vaccines that was signed before the summer. And we bought roughly 300,000 doses of monkeypox vaccine. A first set of doses was sent during the summer, and by the end of the year, the remaining doses will be delivered to member states, Iceland and Norway. We have also launched EU4Health. You might have heard it. It is a big contract. It is one of the answers to crisis, and solution, I would say, to crisis preparedness, where as contracting authority, we are ensuring ever warm facilities for vaccine manufacturing across EU and EEA to secure early availability of manufacturing capacities. It means that if there is a crisis, so we sign this contract, and if there is a crisis, the manufacturers that are part of this contract will start producing vaccines for us. So it is a way to really avoid any kind of, if there is a crisis, we will not remain without vaccines because we will activate this EU4Health. So the request to participate is closed. It was closed during the summer, and we are now assessing the offers received. What do we have in terms of open calls currently open? So there is the first one closes today. So, I mean, it's not really worth promoting it any longer. But the next three, so the EU preparedness, the capacity and capability assessment and training programs for health specialists, it will close again, well, in 3 days. But, it's still worth advertising it. We then have a multiple framework contract in cascade for the support of services to manage expert groups in the field of health. And this is a framework contract where we are seeking support for the organization of meetings. And the deadline for this call is the 7th of October. And then the last one is a framework to support the revision of tobacco control acquis. The deadline has been extended, and the new deadline is now on the 14th of October 2022. I've put direct links to all the call for tenders. So either you go through e-tendering and go through the process of clicking, or you just use this direct link. We also have 3 calls that are upcoming in the strand cancer, so CR. We have the development of a code of conduct on fair access of cancer survivors to financial services. For this one, we have published a PIN, a prior information notice, that is available on e-tendering, and that raises awareness. So it says that this call is upcoming. So it is a way for us to basically give a bit more time to applicants, to economic operator. It's a sort of alert saying, stay alert because this call is coming. We then have a study on obstacles for cancer survivors to return to work. This should also be available on e-tendering in October. And then we are also launching a new framework on the technical group supporting the characterizing flavors procedures. And this is again linked to tobacco. And it is planned, it will happen in the coming months. In terms of crisis preparedness, we have 2 contracts that will be also published soon. And as you can see, the budget here is rather interesting. So we have a study on market research and mapping of innovative testing solutions. And then we have this IT development for early warning, modeling, simulation, forecast, with a indicative budget of 24.5 million. So you can really see that it really depends call by call, but we have, I would say, big budgets for the types of services that we are buying. And then we also have upcoming calls in the health systems, HS. So a set of guidelines on access to healthcare for people with disabilities, and then supporting the cooperation between national authorities and professional sector associations in the blood, tissue, and cells and organs sectors. And again, you can see the budget is roughly, or indicative budget is roughly 700,000 euros. I cannot say more about these calls because we don't have the technical specifications yet. This is the information that is available in the annual work program 2022, basically. Last but not least, I would like to raise your awareness on this Ern Mobility Program. This is a very interesting program. This is a legacy from the third health program, and it is an exchange of healthcare professionals between healthcare centers. So we give through this program the possibility to have exchanges in between 1 or 3 weeks, and all costs are covered. And the field tackled is the field of rare diseases. So let's put it, it's like a sort of Erasmus, Leonardo program for healthcare professionals. And it is a very, I would say it's a very good opportunity to network, to discover what other healthcare centers are doing in Europe. So if you could advertise this, it would be excellent. I will share with you also a video. I still need to upload it, to have it uploaded on our audiovisual page, which explains more into details this Ern Mobility Program. So if there are any questions regarding applications, you can contact the Ern Mobility Program mailbox, which is the email address is right here below. And as you can see, this is also implemented through a service contract. So you see, we have a lot of different types of actions or services or supplies that we are buying. So I think there is space and room for all economic operators to apply. EU4Health has a big budget available for procurement, and participating in procurement has also an impact on policy development. So it's not only that we are buying a service and that's it. Through studies, the parent DGs implement or further develop policies through buying supplies. I mean, in terms of for instance, monkeypox vaccines, we are contributing to achieving the objectives of protecting citizens. So procurements have also their role in ensuring that EU4Health meets its objectives. This is my last slide, actually. This is where you can find information on procurement. E-tendering remains, as I said, the official channel. We then mirror this information on HADEA website, on HADEA Twitter, and within HADEA LinkedIn page. So what I would suggest, I don't know if you have as a joint action, I imagine you have a presence on social media, but it would be great if you could, if we can follow each other and tweet or retweet or post and repost information about call for tenders. So thank you very much for your attention. I hope I was not too long, and I hope that everything was clear. Otherwise, I'm happy to answer your questions either now or during the Q&A session.
Thank you very much, Chiara. It was really a comprehensive and detailed presentation and very practical. And actually, there are a lot of questions from the audience. So I will start with France. I give the floor to the Minister of Health of France, and that I have to ask some question about evaluation. But yeah, I'll give the floor to Tim. Yeah.
Thank you very much, Francesca, for giving me the floor. If you don't understand me, just tell me, and I will put the question in the chat. Thank you very much also, Chiara, for your very interesting presentation. Actually, I have two questions. The first one is on evaluation. I would like to know, and the French ministry would like to know, and also the Ministry of Economics, when it comes to evaluation, for instance, for vaccine contracts, you talked about the Fab Lab and the Everwarm facilities. How do you get the expertise, the technical expertise on evaluation of these quite complex technologies? Are there internal or external expert committees that you consult with when you make your evaluation decision? If so, how do you select members of these committees, and are they remunerated for their activities? So that's the first question. I guess the issue, the why we raise it is quite clear. It's to understand how you gain that expertise in order to make these decisions on very important amounts. And more specific questions when it comes to specifications, technical specifications. You talked about you explained the example of the 160 million Everwarm facility Fab Lab procurement that's already been done. And so when we were in the steering, and myself in the program committee, when you look at the 2022 program, it specifies which kind of vaccines are part of that 160 million procurement. And I just read out real quickly the four technologies. So it's the new mRNA technology, vector protein inactivated virus-based vaccines. And what happened is when you published the specification, technical specifications, the last part, inactive virus-based vaccines, disappeared. And I guess it's quite important rendering of the content of that contract, which also has implications about vaccination strategies, economic implications. So we would like to know how it can be explained that important parts of what we decided on the steering committee are disappearing or changed when you make the specific technical specifications. Maybe there are good reasons for that, and we would like to understand better how this happens. Thank you.
Yes, so thank you very much, Tim, for your question. So in terms of evaluation, I said at one point in my presentation that evaluations are conducted internally in HADEA with the parent DGs. So this happens for studies, so for most of the calls. For the ones that are, of course, a bit more technical, we are actually reaching out to external evaluators that have the technical capacities or the technical expertise to address, to assess the technology, or so be that the vaccines or platforms, IT platforms. I was not involved in the EU Fab as such. I can look out that for you if you want. And I can see, I guess, that the evaluators have been reimbursed, or they have not yet started working, but I think they get a reimbursement for travels and accommodation. I'm not sure that they get a remuneration. If that is the case, it would be the typical remuneration for experts of the Commission. But I will double check that so that I give you the correct answer. In terms of tender specifications, what happens is that there is the annual work program that is published, and this is our legal basis for developing the tender specifications. But then there are also a lot of ongoing discussions with the parent DGs. In the case of the EU Fab tender specifications, those were drafted in collaboration with DG Grow and with DG HERA, and they were, it was a joint effort, and most probably the changes were due to a change in the current situation. So the annual work program, the problem is that the annual work program is prepared a year in advance. So very often things change in between. So technical specification actually reflect the current situation of when they are drafted. So that's it from me.
Okay, thank you very much, Chiara. I think you replied. There is another question from Sarah. I don't know if you want Sarah to ask directly, or I can go and ahead and.
No, it's fine.
Okay.
Fine for me. Thank you for the opportunity. In the first one of the first slides, you mentioned the participation of a group of tenderers. My question is, based on European Commission procurement framework, is it required that power of attorney is notarized? So is required a notary seal and signature on the document or not?
I don't think we need a notary. So you don't need to go to the notary to get this power of attorney for joint tenders, but I can double check that, but I don't think that it's needed.
Okay, thank you. If they are not constituted as a group, yeah, the question is if it's followed the legislation and administrative law of the country of the representative of the group, or is not a requirement from the European Commission specifications. This will be very useful to be analyzed and taken as an example for cross-border procurement. And if the question is if a power of attorney template is available, just to see and check this.
I think, yeah, no, I'm not muted. I think that the power of attorney, I think it is part of the annexes as well. So you will find it together with all the documents.
Okay. Okay. And then it comes to my mind another comment or reflection. Is they are thinking to embrace the innovation procurement paradigm as DG Connect has done, implementing innovation procurement in the form of pre-commercial public procurement or procurement of innovative solution, where the requirement and the specification are not binding and very technically defined, but are functional requirement or performance requirement, and IPRs are assigned to the contractors. These change in the paradigm enable innovation, enable the participation of SMEs, and reduce the cost of the solution and services due to a competition and the opening on the market. So is this paradigm being considered by
I would say not at the moment. We try to have specifications that are as prescriptive as possible, without, of course, targeting only one economic operator. But we really try to have the specifications are specific as possible. This is because we are spending public money, so we really want to ensure that we are not like that the offer matches what we are looking for. So we want to avoid like a contract or a tender to say, I could organize 15 meetings and then they only organize 5. So the more detailed the specifications are, the more we are on the safe side in terms of spending and checking and getting the results. So at the moment, we are not looking into that.
Okay. I was referring to more technical tenders, of course, not service-based tenders, for example, for devices or studies or methodologies or that involve a kind of innovation, a radical or incremental innovation, of course, not in standard services.
But no, so for standard processes, no, but for we are now, we have, I think, a couple of more technical, let's say, tenders coming. So 24 million one from HERA, and then we have a couple of apps, cancer apps, but those are under evaluation, so that's done. But I can raise the issue for the HERA call to see if what is the approach that is going to be undertaken for that one.
Yeah. Thank you.
Okay, thank you very much, Chiara. Another question from Amanda Daly, National Focal Point for Ireland. What is the timeline for a PIN to be published?
In what sense?
Amanda, I give you a floor.
I just want to check, how far in advance is a PIN published in advance of the actual publication on e-tenders?
Actually, it really depends. I have experience of pins being published a year before, and the call being published 9 months after. And sometimes we have less distance between the pin publication and the call publication. Usually a PIN has a duration of, I think, a year. So it really says that the action is going to be launched in between today, for instance, and the 19th September 2023. But it really depends on call per call.
Okay, that's helpful. Thank you.
And sorry, Chiara, I want just to jump into this topic. Just is available the prior information notice for all the tenders? Sorry for my ignorance, but
in principle, yes. We are not obliged to publish the PIN for all of them, but we try to do it as much as possible because we recognize that it gives a bit more time informally, let's say, in the sense that there is no specification published, but at least economic operators get an overview of the subject, the aim, the objective, and the indicative budget. Of course, the PIN is not binding in the sense that things can change once the tender specifications are published, but at least it gives an indication.
Exactly. Okay, thank you very much.
You're
and
welcome.
Next, I think last question. Perhaps it was mentioned, but do the tenders also specify wherever they expect to give out multiple contracts to separate service providers for a tender? It's from Just Ibring.
No, so if I understand correctly, you want to know if for one call we can fund more than one contract, or we can sign more than one contract, correct?
Exactly, like for example, the EU4Health tender.
So, well, the EU4Health is a bit per se, because this is going to be, if I'm not wrong, a framework contract that then will have specific contracts. So as a framework contract, it's going to be signed with a number of economic operators. If you look for a study, for instance, like studies, usually we fund, we sign, one contract only. So if we are saying that we have, unless of course it's specified in the annual work program, but usually it's one study. So I don't know, if we have 300,000 euro for study A, we launch the call, we receive the offers, we assess the offer. We usually fund the best, the first one, which is then ranked based on the best price for value, for quality, sorry. And we only sign one contract. So usually it's one procedure, one contract.
Okay, thank you.
Okay, I think there are no more questions. So thank you very much again, Chiara. I hope you can stay with us until the end of the webinar. So thank you very much. And I will move ahead with a presentation from Margherita Gentile and Maura Mareri. And the floor is yours. Thank you very much.
Hi, good morning, everyone. Can you hear me?
Yeah, we can hear you.
Okay, so thank you for the invitation. We are delighted to participate in the workshop, and I'm Margherita Gentile, working at the Italian National Trust Plus Center at the Foreign Affairs Division. And here with me, there's Maura. Morning. And so now we will try to explain and show you our experience in preparing and managing the proposal for the call for tenders. CNT have been participating in several call for tenders and call for proposal, and actually so far we won 2 service contracts. So I show you our presentation. Okay, can you see it? Okay.
Yes, perfect. Thank you.
So as a first step, we suggest to once you select the call you may be interested in participating, then you focus on the scope of the call and verify and check if you and your institution can really perform all tasks and activities required by the call. So once you decide to go for this call of tender, then it's crucial to decide if you want to be a single tenderer or a joint tenderer. Of course, this make a crucial difference. And in our experience, if you go as a single tenderer, of course you will be asked to produce less documentation, but then you have more responsibility, and the risk of the call is totally on your own. On the other hand, if you go with a consortium, so if you construct a consortium with other institutions that want to join the proposal for the tender, then you will, of course, have to produce more documentation, but then you will share your responsibility, you will share the writing of the proposal, and of course, you will finally share the risk. So then it's crucial also to understand if you want to subcontract some subject, and why subcontract, because there are some subjects that maybe you want to involve in your proposal, but they have no financial capacity, for instance, to be a tenderer, or they have an extra EU legal entity or other issue. So the subject that you have chosen, it can't be a joint tender, so it has to be a subcontracted subject if you want to involve it. Or otherwise, you can also need a subcontracting to increase your human resource involved in the procurement service activities, or more to perform a residual work, and or to integrate some technical specific skills that you may miss on your organization. So what we would strongly suggest when you prepare a proposal for a call for tenders is to take into consideration the timing, because as we have already seen in the earlier presentation by Chiara, we have, the subject who is going to submit a proposal for a call for tenders has to collect many documents, a lot of documentation. So take your time, because this activity takes more time than you expect. So in our experience, as soon as you decide to go to participate in a call for tenders, then you have to focus on which documentation you have to provide. You have to collect first and then provide. And especially if you are a joint tenderer, you have to know that you have to collect the documentation from all the subjects involved. So pay particular attention to the economical and financial capacity documentation, as for instance the balance sheet and the profit and loss accounts. And for instance, for a public institution, this profit and loss accounts document can take time to be released, because like for our case, we have to ask it at the central administration office. So please consider that it could take time. And we also suggest to pay particular attention to the technical and professional capacity requested in the call for tender. So when you write the proposal, pay attention to be compliant with all criteria listed. For instance, it could be criteria T1, T2 or more. And for any criterion, be aware to respect the minimum level of capacity requested and to provide evidence. For instance, the CVs you provide, it should be focused on the scope of the tender, or you can, in the CV, you can ask to highlight the experience that is crucial for the scope of the tender. And last but not least, it's very important to pay particular attention to the budget construction. In the tender specification and documentation, they will provide a financial offer form to be fulfilled. And you have to provide, of course, the best value money, and it's important that you, as a group leader, in case you go for a joint tender, you ask for a detailed economic quotation to the other subject that participate with you in a joint tender. So you have to ask it in advance, so you will be able to include the single offer in the total budget construction, so the total offer. And then please be aware about the VAT, because in a EUA regulation, you can have some cases that you don't have to include the VAT in the budget final calculation, or other cases in which you have to include the VAT in the final calculation. So the last, just look in the tender specification, because usually they insert as an annex a very clear list of documents to be submitted with the tender. So you can see also if you are a group leader or member of the group, a joint tenderer, and then you will have the list of all the documents that you have to provide. Please be aware, because it's very important to provide all the requested documentation. Now I leave the floor to my colleague Maura.
With this slide, we would like to show you the principal difference between the EU calls for tenders and the EU calls for proposals, according to our experience as participants. For the EU call for proposal concerning payment arrangements, you usually find a pre-financing. It means that you will receive money to start your activities. Instead, in the EU call for tenders, pre-financing not always is applicable. Actually, as Chiara told now, it's not foreseen. In the past, we received a pre-financing, but now it's not possible. And concerning the co-funding, in EU call for proposal, it is foreseen that you co-found the total budget. In the EU call for tenders, you receive the global budget. The administrative management in the project request that you provide detailed financial reports and supporting documents. For example, the subcontractor has to provide the invoices to be uploaded in the EU participant portal, and European Commission reimburse you the real costs. Instead, in the tenders, the administrative management is more flexible since the group leader has to provide an invoice with total costs from its organization, from the other tenders, and from subcontract. The respect of timeline and tasks achievement is more flexible in the projects and is mandatory in the tenders. The intellectual property right, as Chiara mentioned in her presentation, concern that the results in the project are owned by beneficiaries. Instead, the property rights are acquired globally by the contracting authority in the tenders. And the results in project are mainly intellectual. It means that you have to produce guidelines, manuals, reports. Instead, in the project, in the tender, you have to provide a good service or supply. And now we would like to show one of our experience as a tender with Aeroset 128. We won this tender in 2011. It was a service contract financed from the EU Public Health Program, and it was on the creation of reference compendia for the application of the single European coding system for human tissues and cells. We were a consortium with Arman Technologies, our technological partner, a company with extensive experience in designing and implementing IT systems for traceability and management of transplantation activities. And we include in our consortium a society, ICBA. But we needed to include this organization as subcontractor. And why? Their subcontracting was mainly due to the fact that this important international organization is not based in a European member state. It is based in the United States. And sorry. Okay. What we did, we produced the single European code. Why it was foreseen in the Article 10 of the Directive 86 of 2006. And this is an alphanumeric code that carries information on tissue establishment, the donation number, the product code, division, and expiry date in a standard format. And this is the layout in this slide. And what we gained now, anyone in Europe is able to insert the single European code from the label on the product in a publicly accessible code translator hosted by the European Commission. And this allows access to the compendium record for the tissue establishment that is responsible for the safety and quality of that product, providing the authorization status of the tissue establishment and the details of the competent authorities responsible for its regulation and the EU generic description of the product itself, guaranteeing the transparency and the traceability of the product. And at the end, we transferred all the results to the European Commission, and now it is accessible on the on this website, on the platform on the European Commission. and which obviously transfer the whole data intellectual right to the European Commission. And now Margherita will show you another European tender that we won.
It was in the 2015, and it was a service call for tenders specific in the field of organ donation and transplantation, and it was launched in the framework of EU Action Plan on organ donation and transplantation, strengthened cooperation between member states. And the main focus of this tender, it was for the training for trainers and the social awareness about donation and transplantation all over Europe. So we as CNT participate as a joint tenderer. In fact, the University of Barcelona with the TDI Foundation, which is a foundation of the University of Barcelona that is specialized in training, invited us to participate as a joint tenderer, and we accepted, and we actually finally we've been successful, and we won this service contract that was for 36 months, and we have 4 would-be with train the trainers and social awareness, dissemination, and evaluation. And it was very interesting actually call for service contract that we win, because we have to organize these online webinars and models for already specialized organ procurement coordinators, and the training course were focused on the training that this coordinator were meant to bring at their own countries and to spread other training activity on their own country. And another activities that were requested from the service, it was to organize some social awareness event to improve the knowledge and the awareness of the citizens and of people all around Europe about organ donation and transplantation. And this was very interesting call. We participate, and last but not least, I would like to just to suggest you, when you write a tender, as we did in this case, pay a lot of attention also to the consistency of the language. So use all the language that is in the same framework of the language that is used in the tender specification, that is tailored for the scope of the tender. And if you use acronyms, then at the please specify all the acronyms that you will use in your proposal. And if you all have any question, we are available and happy to answer your question. We hope we have been enough clear, and we actually hope to have given you some useful tips and suggestions.
Thank you very much, Margherita Maura. Everything was really clear. Thank you for all this practical, for bringing your experience. It's very useful. I will remind that all the presentation will be available on our website and in the website of the joint action. So if you're interested to have a look on them, they will available. I cannot see any question from the audience for the moment. Correct me if I'm wrong, but no. I have just a small question, which was I will say the biggest obstacle or you know, the critical moment in your path during the proposal submission and in the and after it?
Oh, well, in Aeroset 128, during the preparation phase, we fighted in budget construction and also to build the consortium in order to know if ICBA could reach us as a subcontractor or as a tenderer. And during the managing of the tender, well, we encountered the difficulties in the in the invoices example, since we asked our tender and subcontractor to clarify the expenses, but then we needed to provide only one invoice, so we needed to enter in this procedure since we had more experiences in project financial reporting.
And in writing the proposal, for me, I mean, it was not an overall obstacle, I would say, that even when you think you have finished with like one paragraph of your proposal, but then you have to go through, I would not say 100 times, but in fact, because I mean, reading the tender specification more and more times give you more specialized tips than you will focus, because at the beginning you think that you got the general idea of the tender specification, then you start to writing down it. And that's right. But then when you go through any paragraph, as I said, any criterion and award criteria, then read and read it again, because every time that you read it, then new ideas and new items to be included will for sure come up. And then, and even if, and this is also why I put that clock, and I want to stress the timing, because it's very important that you start to work, because as Chiara said, you have about 40 days to submit your office, which seems a long time, but in fact is not, especially when you have when you are a joint tenderer. So you have to collect all the CVs and statement of availability and check every time all documents, because every time someone forgets something like the date, the signature, or is not a PDF file, it seems something collateral. But then when you have to do everything together, then which is not, and never be alone, of course, just be a team that support themselves during all the preparation of the offer.
Okay, thank you for your valuable tips. And I don't know if Chiara would add something, but just related to that, I want to ask Chiara if, but because it happens that some proposals don't meet the requirements. So which are the most common mistakes, and if you can give us some tips also in this with regard to the tenders.
Yes. So first of all, thank you very much, Margherita and Maura, because your presentation was very, I think, comprehensive, and sharing experience from the applicants or from the tender perspective is very important, because it's a set of lessons learned for everyone. I think you've mentioned the timing, identifying all the documents that need to be requested. I was, in the past, I worked as an applicant, and it is true, you need time. And 40 days often are not, it's not that they're not sufficient, but You will always have partners that forget or that do not send you the correct version, the signed version. So really, once the call for tender is published, sit down, print out all the documents, and create a to-do list with everything that is needed. It's also another thing is try to identify your partners before the call is published. So once the PIN is there, or if you go through the annual work program, you can already have an idea of what is going to come up during the year. So really try to build your consortium, identify your partners in time, because this is really time consuming. As maybe I mentioned, but maybe not, there is not a template for the offers. So whereas in grants you have, part A, part B that you need to fill in, for tenders we do not have a template. And this is a bit complicated, I think, because if on one hand we give you the freedom to design your offer in the way you want, you also have to make sure that you address all the elements of the tender specifications. So there is not a winning method. It's really up to you to see and to design the offer in the most in the best way, I would say. And what else did I wanted to add? I think that the more you share experience, the better it is. So if other member states or other economic operators want to share experience, it's a learning exercise, and it's good for everyone. Now, Francesca, in terms of your questions, what is the missing elements? It really depends. It really depends. Sometimes tenders forget to attach CVs. Sometimes the minimum requirements are not meant in the offer. So it means that it just, jumped that part and just produced whatever came up with their mind. Sometimes we also see that we receive offers of economic operators that just give it a try. And they say, okay, I have nothing to lose, I'll just submit my offer, which is not compliant, whether in terms of scope, as Margherita and Maura were mentioning, you really have to focus on the scope of what we are requesting. Sometimes the financial capacity is not met, so applicants, tenderer will participate, although they do not have the financial capacity to then manage such a contract. And all those things are elements that we are assessing. So we have the operational team that is going to assess, I would say, the award criteria. And we really focus usually 3 or 4, and they depend on the type of services or supply we're buying. But then the legal and financial capacity is checked by colleagues from the financial and from the legal team. So there is attention paid to all of these elements. And if just one is missing, then you're out of the competition, of course. So my advice would be share experience, use the national focal point joint action as a place to share lessons learned. But don't miss the opportunity to participate in call for tenders. It's really, as you can see, I think at the end of the contract, when you see the results on the Commission website, or when you see that the results of a study are used to develop policy, I think it's pretty rewarding. So don't miss this opportunity.
Thank you very much. Thank you, Chiara. Thank you, Margherita. Thank you, Mara. It was really interesting. It was, I think I've learned a lot. So I hope all the participants too. And we are perfectly on time. But this is concluding so this concludes the webinar. And thank you very much to all of you for participating in the webinar. And I hope, and we hope you enjoyed the presentations. Thank you very much, and have a wonderful day. Bye.
Thank you. Thank you.
Bye-bye.
Thanks, Francesca and Chiara.
Bye.
Bye now.
Bye.